we're going to talk about the actions of the forearm and hand before we start going through each of the muscles. These are the things that you need to know. Radial ulnar joint. Those are two joints. They're two joints, okay? It's not just one joint. There's a joint up at the top, and the proximal part of the forearm. You'll find a radial ulnar joint where the two attach. And then at the distal end, the two attach again. They do basically one motion, but we have two names for it. When you're turning up, it's supination because you're holding your soup bowl. And when you're pronating, you're spilling your soup bowl. That's a radial ulnar. Radial ulnar. I always remember because the radio is the index finger and thumb, and the ulnar is the pinky side. Okay. So then we have the radial carpal joint. Most of the wrist, I think that the ulna attaches to the radius right in here. So most of the wrist is the radius, and all the carpal attach to the radius right there. So that's your wrist joint. And you have, let's see, two sets of movements. You have extension and flexion. Extension, high five. Flexion, I'm tired. High five, I'm tired. Okay. Radial and ulnar deviation. So the deviation's where it goes side to side, right? Hold your arm steady and you can do side to side. Radial deviation or abduction, the radius side is where your index finger and your thumb are. Then you're deviating to the radius side, and you're deviating to the ulnar side when you're doing the pinky side. Another way to look at it is adduction is toward the center line, where we hold our hand in anatomical position. Adduction is toward the center line, and then abduction is away from the center line.